It's a true honor to introduce Dr. Lori Kogan, a professor of clinical sciences at Colorado State University and a leading global authority in human-animal interactions. As the chair of the HPA's HAA section and editor-in-chief of Human-Animal Interactions Journal, Dr. Kogan's work goes beyond theory. Today, she will guide us through the essential balance between human and animals' well-being, centered around the 5 freedoms. Her insights will help us reflect on how we can ensure that we seek healing for ourselves, but remain deeply committed to the rights and welfare of the animals by our side. Lori.
Thank you. I am delighted to participate today. I am a little in awe over the previous presentations and just the depth of the things that have been shared. So I'm really honored to be here. So I'm just gonna go through a slideshow. Okay, well, thanks again for inviting me. I'm Lori Kogan from Colorado in the US, and I want to spend just a little bit of time talking about how do we balance human benefits and animal welfare in animal-assisted interventions. And so we're going to talk about real briefly what animal-assisted interventions are, the ethical landscape as I see them, a little bit about the human benefits that research has shown us, what the animal welfare concerns are, and then the ethical frameworks leading into best practices, and then go over just a couple case studies, and then what is the pathway forward. So I realize that many of you here already know these things, but I just want to make sure that we're all on the same plane to begin with. And so animal-assisted interventions, that's a very broad term. It's kind of an umbrella term. Animal-assisted services is also another term that's being used along with animal-assisted interventions. And within that umbrella, there's generally like 3 different categories. So animal-assisted therapy, which means that those are goal-driven interventions. So they're delivered by a qualified health professional, and they have a goal of things like improving physical functioning or social functioning, right? So typically you have your professional, and that may or may not be the actual animal handler, and then the animal and the handler, and then the participant. Animal-assisted activities are much more casual, and so these are informal interactions. And so these are things like when people bring their animals into a nursing home, for example, or the cat cafes that we were talking about, and so these don't have some actual goal, but it's really to enrich everybody's life in general. And then animal-assisted education, those are structured educational activities. And so the one we probably think of the most are reading to dogs, right? So it's an education setting. We have children or even adults, sometimes with second languages, reading to dogs. The scale of animal-assisted interventions across the globe is enormous, right? And so even in the US, we have over 20 million programs. There are over 500 peer-reviewed studies just within the past decade. And for example, 74% of hospitals report using some form of animal-assisted intervention or pet therapy. And these are in a multitude of countries, so over 50 countries in the world. So when we start looking at animal-assisted intervention, what is that core ethical tension? And really what it is this balance between human benefits, right? So then we're looking at, the therapeutic outcomes. What are the benefits for the people involved? And these could be things like emotional support and comfort. It could be social skills building. It could be trauma recovery. Several of you have talked about several of these different goals that are included when we're working with animals. But then we also have animal welfare that we need to pay attention to. And these are things like the freedom from fear and distress, the prevention of being overly tired, making sure that they've got appropriate veterinary care access, and things like that. So when we look at the documented human benefits, I'm not going to say that animal-assisted interventions work for everybody, but I will say that they are very, very successful, right? There have been many, many studies that have shown success in things like anxiety reduction, depression, pain perception, ability to socially interact with other people, things like lowering blood pressure. The social interaction, it always reminds me of, even taking a walk around my neighborhood. There'll be people that I see that I can remember their dog's name. Sometimes I'm not very good at remembering their name, but I always say hi because they have a dog. So that social interaction really plays out in so many different contexts. So there have been lots of studies looking at children with autism, for example, and the benefits of animals within that population, dementia patients, a lot of work with veterans with PTSD, and then work with hospital patients as well. So we've known for quite a while about the benefits of animal-assisted interventions for people, but we've only actually recently been paying more and more attention to, well, wait a minute, what about the animal side of this? And I'd have to say that we used to not really pay any attention to that at all. It was very, very one-sided, where what is the benefit to us as people? And I think that it was a lot more thought about using animals as a tool. And I'm really happy to say that we have moved a great deal from that position, and now really looking at not only does it need to not cause discomfort, but we're moving more towards, is it mutually beneficial? And so the starting place for this was the 5 freedoms. And so just as a reminder, those are freedom from hunger and thirst, from discomfort, from pain and injury and disease, the ability to express normal behavior, and then freedom from fear and distress. And you can see that within each of these, there are these risks involved with having animals involved in animal-assisted interventions. And so are they provided with water between sessions, for example? Are they put in environments where maybe it's stressful for them? Are they at risk of being injured, by small children or by people with dementia, for example? Are they able to do things that are natural for them, dog things or cat things or horse things? And then are we in some way putting them in positions that increase their propensity for fear or distress, so loud sounds or unusual objects and those types of things that we need to pay attention to. So I'd like to suggest that this is the bare minimum of what we need to be paying attention to, but we really want to continue and move from that to an even elevated look at animal welfare. Part of the issue with addressing animal welfare is that many people that provide animal-assisted interventions, they may be psychologists and social workers and counselors, and they don't know very much about animal behavior. And so we need to be much better at reading animal behavior to make sure that we are not causing our animals undue stress or distress, right? And so there's lots of different cues that they give us that we need to pay attention to. I often joke that one of the biggest reasons why we have such great relationships with dogs is because dogs are great at reading us. They are super. We stink at reading dogs and dog behavior. So we have a lot of room to grow with that. And we're better at dogs probably than any other species, and we're still not very good. And so anybody that's involved with animal-assisted interventions, I really suggest that that you learn some things about the behaviors of the species that you're working with, and then absolutely your particular animal and how does your animal express stress, for example. So dogs, for example, what does their tail look like? Are they yawning? Are they lip licking? Paying attention to those things. And it's not just one thing out of context. And again, it's really looking at and observing and being aware of the animal that you're partnering with all the time, and especially including when you're in sessions. And the same things goes for horses and then for cats. So again, even more attention needs to be paid to these types of animals that we're not as good at reading. And that actually has been one of the reasons why I'm a little bit reluctant when people talk to me about wanting to provide services with exotics, reptiles and things like that, for example. When I think, I don't know how to tell, like, for example, if a turtle is happy or a lizard is happy or a snake. And until you feel like that you can tell those things, if you could tell when a snake is stressed, for example, then you might want to choose a different species to work with. So there are several organizations that have done fantastic jobs of putting together standards. And if you're interested, then I would suggest that you look at any of these resources. And so Ohio has put together a great white paper on animal-assisted interventions, definitions, and standards. AVMA, the American Vet Med Association, has welfare guidelines. Pet Partners, which of course is a super large animal-assisted intervention program. They do a lot of team evaluations and certification, and they're a great resource as well as the European Society for Animal-Assisted Therapy. And so from all those, we can draw these 8 pillars of ethical animal-assisted intervention practices. And the first one is a comprehensive assessment before you even begin. So as somebody alluded to earlier, it's important to look at whether your animal really makes a good fit. And sometimes what I see is that people very, very much want to do this. They want to provide animal-assisted interventions, and their pet, not so much. And so it's important that you be objective about that and say, is this something that they also want to do? And that can be hard because sometimes you really had your hopes set on this is what you and your pet were going to do. When you're putting together your program, you need to make sure that you've got rest periods and your work hour limits, right? So you don't want your animal to work all day long just because you can. Regular vet visits are important. You want to make sure that the care is appropriate for your particular pet. Again, like we talked about, you want to make sure that you're aware of your animal's behavior and stress signals, and that you've got your protocol set in place of what does happen if your animal gets stressed during a session. Have you talked to people about that? Have you warned them that there might be a chance that you guys need to leave, or your animal needs a little bit of alone time or downtime? Do you have a welfare plan for your animal to ensure welfare at all times? And then do you have a way to monitor this as you're going on? And another pointer is that just because your animal at 3 or 4 years old was really into this doesn't mean at 7 or 8 that they're going to continue to be that way. And so this is something that you're going to want to monitor as you continue on. And so I thought it would be helpful just to give a couple case examples so that you could kind of think about how this might play out in real life. And so one example is a 4-year-old golden retriever who's currently working 6 hours a day, 5 days a week in a pediatric hospital. And everybody loves him. I mean, really, how many golden retrievers have you met that we all didn't love, right? But then a couple questions to think about with this is that how many hours a week is ethical for you to have a therapy dog work? So Rex is working 6 hours a day, 5 days a week. That's too much, right? And so then who has the authority to reduce that? And then how do you make that happen? And then what about all the children that won't get access to Rex? Do their needs override Rex's welfare? And these are questions that are going to come up, right? And so you might be in a position where you're getting pressure from whatever facility that you're working at, is that these kids really need him. They really need him to be there. How are you going to navigate that? And my hope is that you recognize that Rex is counting on you to be his protector. He's counting on you to put those limits and boundaries in place. And so best practice is 2 hours a session, like a day, 2 to 3 days a week. So immediately reducing that schedule for Rex is something that would be appropriate. And it may be what you want to talk to this hospital about is can they find other teams as well so that they're not relying entirely on Rex. The second case has to do with Spirit, who's a 22-year-old horse who's worked in hippotherapy for 8 years, helping children with cerebral palsy. And then a recent vet visit shows that he has early arthritis. And so questions for this are, can a horse with managed arthritis continue animal-assisted interventions? And then how do you weigh, again, that client dependency versus animal pain or animal discomfort? And then what is our duty to Spirit after years of service? And so to answer the question of can a horse with managed arthritis continue animal-assisted interventions, I think that that's a case-by-case basis, and that's something that you need to talk to your veterinarian about, right? But the key element is that remember that this needs to be enjoyable for all the parties involved. And so as soon as it is not, then it is no longer appropriate. And so this might call for either a reduction in sessions or a termination in sessions, depending on how bad that pain is. Certainly enhanced veterinary monitoring so that you make sure that we're not entering into that realm of pain. And then probably talking to clients about transitioning Spirit away and having some type of a retirement plan on board. And so when you're thinking about providing animal-assisted interventions, really it's this dual duty test. And so first is this likely to benefit the human involved? And like we talked about, they're great for a lot of people. They're not great for everybody, right? Some people don't like dogs. Some people don't want to have anything to do with horses or animals and for whatever reason, and that's okay. And we need to honor that. So if the answer is yes, do we think it's going to benefit the person? Then also, is the animal's welfare adequately protected? And only when both of those things are yes, do we want to proceed with animal-assisted interventions. And so just a couple things to think about in some of these different settings. So for example, in psychiatric facilities, you want to pay attention to that clients might have unpredictable behavior. There might be loud outbursts. Do you have an animal that is okay with that, right? And then do you feel that they would be comfortable in that situation? The same thing when you're working with children. So sometimes children can be rough with animals. And so are you monitoring every single second? And are you ensuring that animal's welfare is being taken care of? The same goes with folks with dementia. Sometimes they can inadvertently be rough. So you need constant supervision and making sure that your animal is safe. Also making sure that they're not afraid of things like wheelchairs or other noises that might be in some of these facilities. Certainly in prisons and correctional facilities, there can be really loud noises with doors and things like that. And so again, making sure that that's something that your animal tolerates well. A lot of these floors in these places are really slippery. Again, is that something that your animal is going to be able to tolerate? For veterans with PTSD, making sure, again, that this is a good fit for your particular animal. And then disaster response, this has been something that's really grown a lot over the last several years. And these can be really chaotic situations. And so making sure that, when we talk about emotional contagion, that your animal is staying okay during this process. And that probably means somewhat limited amount of exposure. So when we're looking at recommendations for a pathway forward, so for practitioners, I would suggest that it's really important that you get animal behavior training as well as your techniques and animal-assisted interventions. You figure out what kind of log is going to work for you for welfare. You establish some protocols of when you're going to stop and how you are going to do that. And you talk to your participants about this beforehand so that everybody's aware that this might happen. And for researchers, providing standards for welfare outcomes measurements. I think we need more longitudinal studies on animal health and animal-assisted intervention programs. Again, looking at that emotional contagion and things like that, I think is going to be important for us in the future. For organizations, forming animal welfare oversight committees is going to be really important, in addition to written welfare policies. Things like creating plans for retirement assessment, and so that you are proactively planning for retirement is another really critical thing for organizations to think about, and how to support people that are going through that process. And then for policymakers, so we want national and regional licensing standards. Right now, there really aren't any in the United States, and so that's something that we really need a lot more attention and focus on. Mandatory welfare inspections would be fantastic, and then legal protections for animals that are involved in animal-assisted therapy would be great, and funding for research to continue in this area. So with that, I'm going to end things and say thank you so much for listening today.